Hello and welcome to the Good Convo Good People podcast with me, your host, Jordan DeLeon. I want to thank everyone for listening to the first episode and welcome to the second one. I have a very special guest with us today. Her name is Natalie DeLeon, also known as my wife. And so we're going to be talking to her. She is a registered nurse and a new mom. So welcome, Natalie. Um, so I want to thank you for having you on. And we're just going to talk and a little bit about you. So why don't we start off with, I know about you, but let the people know uh, just kind of general about you, who you are, where you're from, what you've been doing, what you have going on.
Hi, everybody. My name is Natalie. I am born and raised here in Denver. Um, Came from a big Mexican family of there's 8 of us. I have 5 brothers, 2 sisters, and I'm the baby of everyone. I've got my bachelor's degree in biology, and then I have another bachelor's degree in nursing that I just started in February of 2020. And yeah, I've been doing that ever since. I just recently also had a little baby. She is one out of 14 grandkids my parents have. So we're a pretty big family there.
What's that beautiful little baby's name?
Her name is Lila Rose.
Yeah, that's exciting. So you have a pretty big family and a big family. So how was it being the baby? And
It was fine. I was super spoiled, and uh, there's such a big age group or age gap that I don't know. I guess between me and the youngest brother, it's a 5 year difference. And then my youngest sister's 7 years difference. So,
yeah, so what kind of part of town you grew up in? We
I my parents lived in the Westwoods when we moved when I was like 1. So Southwest Denver, like Harvey Park area, is pretty much where I spent my entire life.
You went to Coons Miller and Dell, right?
Yeah.
And then John F. Kennedy, where we met.
Yes.
We have a lot of mutual friends. I think a lot of my friends went to middle school with you. A lot of, and then we have most majority of our friends are went to Kennedy. Uh, but yeah, um, so your parents from Mexico, right?
Yeah, they came here. I don't know. I want to say maybe in the 70s. They're from Guanajuato, Mexico. That's where they met.
Yeah, and I didn't even know that Guanajuato was a state, honestly. And like, I only knew of like Chihuahua and Durango, and I thought that was it. But Guanajuato is. There's definitely a lot of states out there. So yeah, kind of just you're the Mexican American dream. They moved here and started. So what did your dad do?
My dad was in masonry.
Yeah,
And yeah.
masonry. I think is a proper term.
Um, yeah, so that's what he did. He kind of went and built houses and apartments, and he did that pretty much his whole life since he was like 16 or even younger.
Yes, and um, okay, so yeah, and then I think your dad was here first, right? And he kind of started working.
Yeah, he came because my grandpa was here. Um, and then he came over and um, them ended up bringing my mom over. She had my oldest brother and my oldest sister in Mexico, and after a while, she was able to come too.
And then everyone else was born here, right?
Yeah.
Awesome. Yeah, your family. It's a super close family. It's awesome how close you guys are, and been in the family for 5 years now, and absolutely love it. You guys are close, and everyone gets along, and it's awesome. So yeah, tell me. So you're a nurse, right? How's that going?
Well, it's a complete shit show after starting, and 3 weeks later, the pandemic hit.
Yeah, so you're a nurse like right when pandemic started. So I mean, you've kind of just seen it from the beginning till now of everything, and then you were also pregnant.
Yeah, I was 6 months pregnant when I started my nursing job, and then my floor that I actually worked on ended up becoming a COVID unit, and so I had to be transferred down to a different unit just because I was at high risk since I was so far along in my pregnancy.
So I mean, I know a lot of these things, so I think it's kind of hard to like sit here and like ask you stuff that I already know about. But no, so I mean, like what made you want to be a nurse? Like what like think back as far as like when you were like, you know what, this is what I want to do, this is what I want to be. There's nothing else, and this is my goal and what I want. So I mean, just think back as far as your earliest memory of that, and just kind of explain that.
Well, I feel like I've always been interested in the healthcare field. I think just the whole like science of like that's why I got my major in biology. Just the science of everything is really fascinating, and um, I don't know. I guess I'm really just naturally take on the role of a caretaker, and I like care for others, even if it's like putting it before myself. And I feel like I don't know, being a nurse, like we didn't have any in my family, like nobody ever was medical in my family, but um, I think that they're truly like the backbone of the hospital, and I think that they kind of don't give as much credit as they deserve. Um, they know their patients. They know more about their patients than what the doctors do. The doctors kind of or they give their diagnosis and they kind of just briefly like look over everything and they're like okay, they give the orders, but they have so many other patients that they're dealing with that they don't personally know them. And if anybody's ever been in the hospital, they know like their nurses, their maid, their they give them their medicines. They sit there and they talk to them about their lives, and they just tell them like they just are more personable than a doctor would. There's so many times that I've had a patient tell me like, oh, my doctor just didn't even seem like he cared. Like he didn't seem like he wanted to take the time to like talk things out with me and like what we can do and what where we're gonna go from there. And um, whereas like I've actually sat there with my patients and they've cried to me, and sometimes I didn't really have anything to say to them, but like just even giving them that time to like sit there and like let their feelings out to me, it's just kind of like life changing that you could be that support for somebody, and I feel like that's the most rewarding feeling that you can go home with.
No, yeah, I mean, if I think people are definitely born to do things, and for sure you're born to be a nurse. Like, I mean, you've always just been so caring and giving, and it's just who you are as a person, and it's like the perfect field for you and what you want to do in life. But yeah, I mean, I mean, you kind of like everyone gives the doctor the credit. I mean, obviously, they do surgeries and things like that, but for the most part, I mean, the nurse like they're the forefront and the face, and then the doctor comes in. And so yeah, I mean, I actually didn't know that. And so I mean, that's awesome. It takes a strong certain type of person to become a nurse, and that's you. And I love you for that. um and so I guess the timing's about everything. So I mean, how was it? I mean, first, I mean, you went on maternity leave, so I mean, you didn't really get to see the early stages of everything as far as the pandemic and all that. But I mean, kind of after the fact, when you went back to work, I mean, what was it like? Like, what's kind of your perspective on being a nurse now during the pandemic?
Um, I think it's like changed a lot. I don't feel like we're being kind of cared for as much as other people are being in the hospital. I feel like um, they're kind of so short staffed that they're just like, okay, like you're not showing any symptoms, so like it's okay, like just come to work. So I don't feel like we're being protected, um, and that's kind of scary because if we go down, who's going to be there to take care of anybody? I mean, it's not
Yeah.
only COVID patients we're seeing; it's anybody who's sick and you have appendicitis, your gallbladder, you have gallstones, like you break your hip, you break your leg, like uh, we have a lot of alcohol withdrawals coming in, and that's the most deadly like withdrawal that you can have. So uh, it's kind of scary that our frontline workers aren't being taken care of and they're not being protected. Um, and hoping with the vaccine coming out, all that's going to be changing, and um, it feels safer to go to work and it feels safer to come home. And I mean, I personally don't work with the COVID patients, but I've worked with them after. And even though they're technically not contagious anymore, it's still scary.
Yeah, for sure. I mean, and these are the people that we need to be protecting because, I mean, if, all the nurses and doctors, go out, like, we're screwed. You know what I mean? Like, you can't just go pick up an IT guy and go throw him in there and expect for him to care for people. So, I mean, that's definitely huge, and, it kind of sucks. I mean, I think a registered nurse is so general. I mean, what do you specifically do? Like, what's I know what it is, but like, just explain. So, like, you're a registered nurse, but like, what floor do you work on, and what's your actual
So I work on the oncology trauma surgery floor. So
and for people who don't know what oncology is?
it's just like cancer patients that come to our floor, and trauma. So like if of any big, I guess, event. So like this summer, we've had a lot of people have hiking accidents that like fell like more than 10 feet, and I've had the truck drivers fall off cliffs before. So just kind of like really huge.
And they all survived, right?
Yeah, I mean, as far as I know. Um, and then just surgery, so just general like people who need their appendix removed, their gallbladder removed, just who have general surgeries. We kind of take a little bit of everything now that our COVID unit took over one of the floors. We've been getting a lot of like patients who are septic, who have the infection in their blood, and then I mean we take like withdrawing patients, literally anybody probably.
How's that like? I mean, dealing with like people on withdrawals and kind of seeing that like
um,
firsthand.
it's really sad. It's sad that there's so many young people that I mean I feel are close to my age and their like body's just done. They like alcohol has done like so much damage to them that it's irreversible now. Like some people need dialysis forever, and some people are just kind of at the end stage point, and they're in their 30s. Um, and I think that a lot of a lot of it has to do with the pandemic, with people losing their jobs, with people um, just kind of being at home, and they just turned to drinking, and it's ruined so many people's lives that I've seen.
So I mean, it's like mostly like alcohol. I mean, like
No, I mean we get people who are meth users, heroin users, pretty much anything, and they're pretty upfront about it. Ask them like, what drug do you use, and they'll tell you, and they'll tell you how often they do it. Like, I always thought like there was like a stigma like that they would be like, oh no, I'm clean, like I don't, just not want to talk about it.
yeah.
Just kind of like our suicidal patients, like we're supposed to ask them like, do you have like thoughts of like killing yourself or harming yourself? And I always thought like, who's gonna sit there and say like yeah, I want to do it, because then they know, like then we have them like pretty much on hold, and like um but people will tell you like, I do have thoughts of that, doing that, and I have a plan, like, and and we're supposed to help them, like, so it's very uncomfortable like asking these questions, but I mean, it's what we have to do.
Yeah, and I feel like to be comfortable to the point where you can admit like those things, like yeah, I am alcoholic, or yeah, I do use meth. I mean, like that just kind of shows like how deep they are into that, or even with like, I mean, the suicide thoughts, like for you to be that deep into that disease, or whatever it is. I mean, that just kind of shows like where they're at mentally. Because I mean, me and like I was so like embarrassed and ashamed of like my DUI and stuff, and like I didn't really want to express that to people, and so I think like just kind of being like I don't know, in a way, in a sense, like people like accepted that, and like they're like, yeah, I am an alcoholic, I do meth, and like just kind of having that mindset, and it just kind of shows. But and then you also kind of deal with like some like kind of homeless situations, or patients as well.
We do get a lot of homeless people that come in, and they were found down or unconscious, and I mean the situations vary, but a lot of them were found like unconscious, and that's why they got brought in, and they have like a broken bone, or they need something fixed.
Yeah. I mean, on our way home, I mean, we seen that camp set up right there on the corner. I mean, it's kind of, it's like it's crazy to see. And like you said, where were you at? And you seen like a camp where there's never
Oh,
been one before.
well, I mean, I went to go get my emissions test, and right there off like La Pan and Evans. Like I guess I haven't been in that area for a while, but yeah, there was just all these RVs and just homeless people just camping out there. So it's definitely a problem that we
Yeah,
have right now.
it's like a huge problem. It's like any kind of like grassy field, or like just any like open space. I mean, we haven't been downtown in a while. But I'm sure. I mean, you hear it and you see it on the news. Like people are just setting up camp on the sidewalks, and so I mean, I wonder like how much of that has to do with like the pandemic. I mean, I know there's people out there that's definitely lost their jobs, and they have nowhere to go. But I think, I mean, we've had this conversation before where like we're like, how many like of those people are just like, you know what, like just like okay, like I mean, they're capable of working, they're capable of getting jobs, but they're like, nah, I'm gonna set up this shanty town and live my life.
Yeah, I mean, I think it goes both ways. I think it's kind of hard not to be like biased towards it, but I mean, you have to have an open mind and kind of think of everybody's situation's different, and um, just I guess you just don't know what everybody's background story is.
Yeah, and so I don't know. I think that's something I definitely want to kind of get more into. Maybe talk to certain people that deal with it firsthand and kind of change my opinion about it. Because I mean, I know there's people, who just had a hard life and are, just an unfortunate circumstance, and there's are those people, but I mean, there's people who can work and they just choose that. So I mean, that's a little frustrating, but yeah. So all right, so you're on oncology now. So I mean, what are your goals after this? Because I mean, you mentioned to me that I mean, you don't want to be, uh, I guess what
But it's bedside
SEDS merge,
nursing.
yeah,
Um, so I mean, I only wanted to be in the hospital for a year. But I definitely think that that has changed since I've been in the hospital. Like I am constantly learning something new, and like that's not going to change. Like you get a new case, or you get like something you've never dealt with, um and I like that. I like that I'm just learning all the time. I'm actually going to get chemo certified here in February. So I mean that's just another thing I'm going to learn. Um and I really enjoy my coworkers. So I don't know. I mean bedside nursing is really hard. It's like my body's dead
yeah,
after my three like days that I do. Um, like you have to physically move patients. You have to like clean them when they can't clean themselves. Like you're literally their maid. You're cleaning up their room. You're taking their trays. You're bringing them water. You're you're doing everything for
yeah.
them. You pretty much lose all your independence while you're in the hospital. So I mean, I definitely try to get them to do as much as they can on their own, but there's some patients that absolutely can't. Um, so I don't know. I originally wanted to get certified and do like Botox and lip fillers and stuff, and then kind of go in the business with my sister, who's an esthetician, and possibly open up our own place together. And I mean, that's not out of the picture yet, but
It's definitely a goal, and that's
yeah,
awesome.
just down the road. But I'm happy where I am. Night shift's really hard, but
Oh
I
yeah, you work nights. Explain your shift a little bit too.
so I work 3 12-hour shifts, but it's more kind of like 13 hours, and that's if I could even get out on time. So you kind of go in. You have to like get report from the other nurses, kind of get updates on patients and learn about them, and so you need time before and after. So I mean, I could tell you I'm getting off at 7:30, and I don't get off till 8 or even later. But so I have 3 12s, and it's nights, so I go in around 6:40 is when I clock in, and then if I'm lucky, I'll leave like at 7:30 in the morning.
Yeah. No, I think that's probably the best shift. How do you like nights? I mean,
I like it. I think it's a little less stressful than days. Days you're working with like all the therapies that patients are going to, so like physical therapy, occupational therapy, speech therapy, and you're meeting with all these doctors, and you have to deal with all the family members, and your patient's awake, so they want more, and they kind of are a little bit more needier than at night. Whereas at night, like typically I go in, I get report from the nurse. We go in, we see the patient, make sure they're okay, introduce myself. Then I go to my desk and kind of get our nights organized and see what medications are due throughout the night. Read about them a little bit and kind of what's going on, what the plan is. And then I usually probably start trying to pass their medications around 8 p.m. and then hopefully be able to chart by 11. But there's been times I couldn't start charting until like 3 in the morning. So,
and it's like never the same thing. Like it's always something kind of something new
um,
each shift. I mean, you
well, I
you
mean,
do get the same patients, but
when we do get the same patients back, it's really nice because we can. I mean, not much has changed since the day before, so it's a lot easier for charting. I mean, you know your patients, you kind of know what's going on. Just because every nurse at night gets 6 patients, up to 6 patients, and that's all kind of a lot. Like it's a lot of
yeah, I mean,
people.
to me, I mean, like, wow, like,
um,
but 6 people.
Yeah, so and not everybody's just as needy. Sometimes we have somebody who's like super independent in the room and doesn't really need much from us, and those are always nice because then we could kind of focus a little bit more on the people who, like, say a patient who has dementia and is trying to get out of bed, and you're like trying to get them to not fall, and your bed alarm's going off, and you're running in there every 2 minutes, and they're fighting you, and like I've been hit by a dementia patient before, and a strong little old lady, um, but they're kind of the ones that they're like my problem childs in the hospital.
Yeah, so it's definitely never boring. I mean, when you come home and it's you almost always have a story for me or like something that happened. So I mean, it keeps you on your toes, and it's not a boring job.
No, I mean, like especially from the job I had before, I kind of was just like it was like a routine. Like I knew what I was gonna do. I knew like I didn't have to put any like thought into it, and I mean I loved that job because it was so easy, and I really loved my coworkers, and um they took really good care of me. But like here, like being a nurse, like you actually like have to put what you learn to use. Like you have to think outside of the box, and um like even if somebody's complaining like, oh, I just feel really cold, and you're just like, oh, okay, and then after a while you're like, well, wait, like are you cold or are you like getting an infection?
Yeah.
um and so then you kind of just have to like start thinking about things and putting stuff together.
Yeah. Tell the story about the lady that you saved and
Oh, well, I mean, I don't know how much detail I get
no, I
into,
mean don't
but
don't go use her name or stuff, but
um,
just kind of like just walk through like stuff that you notice, like just kind of explain in general sense of like what happened because I mean you saved that lady's life.
well, so she already has a history of like cancer, and she basically in the middle of the night, like we go in there and she had to go to the bathroom. We helped her go to the bathroom, and then all of a sudden she just can't walk anymore, and basically like falling on us, and we're like trying to keep her up from touching the floor because then we had to do like fall paperwork and um, all that. And so then we get her into bed finally, and then she's just complaining that she's really cold. So I give her some blankets. I turn the heat up, and I um, then I start thinking, and she's just like shivering, and I'm just like, I don't like it. Let me like, take your temperature. Like, let me get some like vital sign, and see what kind of like where your temperature's at, and like blood pressure and all that. And um, then it turned out she had like 101 like degree temperature, and so then like I just called like our charge nurse, and I was just like, no, like things are okay. Like she's different. She's saying she's really cold. Um, I can't even remember what her blood pressure was, but basically she was going septic. And we ended up calling a sepsis alert, and the doctors came in and saw her, and we got her on antibiotics, gave her some fluids, and I mean, eventually took care of that infection before it got bad because things with sepsis is that it's all about time, and the earlier you catch it, the like better it is. So I mean, if you go septic for too long, then you could die. So
Yeah, and I mean it's your schooling and the education and stuff you got where you're able to check out those like notice those signs and kind of put two and two together. So, but no, I mean that's awesome, and you were recognized for that at work for catching that. So I mean that's amazing, and I'm sure that lady and her family are very grateful for you.
yeah, it was pretty rewarding.
And yeah, it's part of the job. So yeah, I mean the biggest thing. I mean, biggest thing for me, but probably the biggest thing for you is being a first time mother. How you feel about that?
It's a lot of work. Um,
Y-
it's the best thing in the world, though. I wouldn't trade anything for it. So
and you're lucky because I mean you kind of been around babies, most of your life, and so I mean you had a little bit more experience than I did, but
yeah, I mean, I take care of all my nephews and nieces pretty much. So
you
I
were
have
like
a
the
little bit.
designated babysitter.
Yes. So everybody out there owes me a lot of
Oh yeah,
babysits.
we got a ton.
Um, but it's great. I just noticed I don't know if it's because I am a nurse, but I'm super like hyper vigilant to everything that goes on with her, and I'm always freaking myself out. And um, I just want to protect her, but I especially get like nervous like bringing like COVID home and giving it to her, and
Yeah, that's kind of always been like a concern of ours. Just like you being in the hospital, and then uh, you know, and your mom watches her, and I mean, your mom's a little bit older. Both your parents are, so
yeah,
it's
the last thing I want to do is give it to them, and anybody who's immunocompromised around me, but and even give it to her. Like, even
yeah,
though it doesn't affect babies as much, but I mean, everything's still new. We're still learning so much about COVID that there's there's it's literally like not a something we can like, oh, these are the symptoms. That's
yeah.
it. Like, um, it's definitely new.
Because I know for like it's hard because whereas we want to show her off to the world, especially when she was first born, like where typically people are kind of like everyone come see her, and like here's our baby. We're like just kind of how to keep her safe and keep her from having so many people to see her. I know there's a lot of people that still need to see her, but it was a hard time I think for us to have a baby.
Oh, for sure, but um, she also hasn't had a cold,
I
so
know.
and it's our RSV season, so that's kind of nice that she hasn't gotten really sick. But yeah, I mean, a lot of people do still need to meet her, and hopefully, with like I said, with the vaccine, like I really do believe in it, and I do think that it'll help control what's going on. And I know everybody kind of is just like, oh, I'm not putting that into my body, but then they're getting like lip injections, they're getting like boobs and
Yeah.
Botox, and
You'll put that in there if it like if it makes you look good, but like you're not gonna put a vaccine. And I think the most frustrating thing is like most people that are like that, they're kind of like that because of something they read on Facebook.
well, not only that, but I just don't think they've actually like how many of them have actually walked in the hospital and seen these people like that are on like ventilators and intubated, and um like why risk that? Like, why you don't want to put something in your body because you don't know what's going to happen, but you're using your iPhone, like you're eating like all this bad food, like, but you're putting that in your body, but like to like save like your parents, your grandparents, like, or like your somebody else's parents, like from getting sick, like that's just really selfish.
Yeah, for sure. And I think for us now, I mean, we're trying to cut out the processed food or try and do the whole food things, which has been a little rough. But I think that's the biggest like kind of eye opener for me because I mean, um, listening to the podcast, Joe Rogan's, where he's just kind of like talking about like just taking care of your body and building your immune system. I think that's like the biggest thing with this. Is I mean, if you take care of your body, it's going to take care of you.
Which I agree. I mean, I do think that as well, but like it's only going to get you so far. Like you still need vaccines to
Yeah.
combat these
No,
like
of course, of course.
viruses and these, you know, diseases that are going around. So I don't know. It's just been challenging. That I think that's probably the most challenging part for me is like I see people always like post like, oh well, it's a high survival rate. Everything's fine. Everything's fine. But then sure you survived, but now your lungs are basically like shot, and
Yeah.
you have to use oxygen for the rest of your life, or like now are
Or
you
like that
doing
UFC fighter who he gets like blood clots now.
yeah, like you like got a clot and it causes you to have a stroke, or you like have early sets of like heart failure, like there's just so much more that goes beyond it. So like sure you survived COVID, but now you're dealing with everything else after it. Like I've seen healthy people have it, and they're like can't walk across the hall and like they're out of breath.
Yeah, so
So
definitely long-term effects of it that people are kind of like overlooking, and where it's like, oh, I mean, if I don't die from it, and I think for the most part, like kind of our age of people, uh, like we're not the highest risk. We're probably like the lowest risk, and but it's still like people can get it and give it to their parents, and I mean, people forget it's a disease that could be spread, and
yeah, I mean
so
it's a
that's
virus
frustrating.
and
Yeah.
it's spreaded easily, and it's I don't know. I guess it's just if that doesn't affect you personally, you kind of just don't care about it, right?
Yeah,
So
and that's kind of something I noticed like during this whole pandemic that I mean I was mentioning to you like I mean two of the biggest things that are shown is like people's ignorance and then people are like selfish like I mean everyone sees the people partying constantly every weekend sharing bottles and doing all this and that and it's frustrating for me and you because we're like we can't even go take our baby to see her cousins or her aunties and her uncles because this virus is still going on but you see these people that are sitting here having the times of their life and not taking it serious so I mean it's super frustrating for me and I mean we always talk about it.
yeah, and I mean I definitely think that a lot of people do it like, and then they go and give it to their grandparents, or you know what I mean, and it's just all that for partying. And I
Yeah.
don't get me wrong, like we've seen friends like we haven't been extremely quarantined, but I
Yeah,
think
I
we've
mean,
done
we
our
did a
part
couple
pretty well.
things. We
But
went to a wedding, but yeah, I mean, for the most part, I just think those, I mean, the baby, and then my situations definitely kept me from wanting to party and live that life. I mean, who knows if we didn't have her? I think we'd probably be a little more safe just because of your parents, and we're not selfish like that. But yeah, I mean, for the most part. It's tough to see. Like I think that situation kind of made this whole lockdown and all this stuff and mask mandate and all that go on a lot longer than what it should. Because, I mean, look at New Zealand. I mean, these other countries, I mean, given that they're on an island, they completely closed. But there's other countries out there that they're almost back to normal, and where we're still trying to figure it out.
Yeah, and I mean, there's even, I hear stories like that our patients are like being extubated, so they're getting taken off the ventilator, and they're still saying that COVID's not real. Like they're still like saying like, no, this isn't real, but you're just like, well, you're here at the hospital,
Yeah,
and
you're on it.
literally we're just on a ventilator
Because of it, but it's not real.
Yeah, so it's, I don't know, it's kind of just frustrating, but I just think like a lot of people don't see like, even if it's not affecting you personally, it's affecting somebody, and like whether this person survived or not, like, people are having to say goodbye to their family members through like Zoom. Like, imagine having to like say goodbye to your mom, dad, grandma, grandpa, like, and you're having to tell them like bye, like you'll never see them again, you'll never talk to them again, and you're saying your goodbyes over a Zoom call. Like,
Yeah,
you can't touch them, can't feel them, can't kiss them. Like, that's it. And even if you survive, like, people are just like, they have spent like they spent a whole month in the hospital. They've spent like without seeing anybody. If you have COVID, they don't allow anybody to come in and see you. So like you've spent all that time, and like you missed out on so much, but it's not your problem because you're not dealing with it, I guess.
Yeah, exactly. And I mean, like in March when my grandfather died, there's only 10 of us that we couldn't even have a funeral session. We had to have a viewing, and there was only 10 people there, and where there's obviously 100 people that could have been to the funeral. And it's frustrating. That was like one of the most frustrating things for me, and I think people don't like see, like, just because that's not happening to you personally, it's not a problem. And I think that's the biggest thing, is just people are selfish and they're ignorant.
But I just think people don't want to be told what to do.
Yeah, and I mean, that's like the most, like, a lot of people in this country are just big babies. Like, no, you're not going to tell me that. Like, no, I'm not going to listen.
Pretty much.
Yeah, you can't control me. I'm not going to wear this mask. And I mean, even wearing a mask is not horrible. I'm so used to it now. Like,
no, I mean, I probably would never want to enter a patient's room without a mask, even after. Yeah,
and
COVID.
so kind of touch on that, where like people are like, oh, like masks don't work.
Well,
and like the anti-maskers and all that, like I think you have a really good take on it, and we kind of came up with, so like kind of touch on that a little bit.
Well, I mean, would you want your surgeon like doing open heart surgery on you when they're not wearing a mask? Like, wearing a mask has been around before COVID. Like, if you go into the doctor's office, you'd always see a sign like, if you have a cough, cover it, like wear this mask. Like, the flu is down because people are like wearing a mask. People are washing their hands, and like, there's been, I mean, just proven science that masks, like, you don't breathe in as much as what you like would, and you're not like spreading your droplets everywhere. So like, if somebody had like the flu and they're in the hospital, like, we'd always have to wear a mask. Like, that's just what it was. They put them on certain precautions, and we wouldn't go in without a mask. And so like, it's been around. Like, you would think that if it didn't work, then everybody in the healthcare field would be sick. Like, everything. Like, I can guarantee you there's so many times that there's been a patient on our floor where they shouldn't be, like, with COVID, but they have COVID, and so that puts us like at risk, and nobody's gotten it. I mean, there are people on our floor that have gotten COVID, but we can't prove if it's from the hospital or from outside resources. Like, there's been some people that admit, they're like, yeah, it's from me hanging out with so-and-so, or, but we would come home with different diseases pretty much, or viruses every day, if like masks didn't work.
Yeah, like, if you're going to have that knee surgery, or if you're going to have that back surgery, or open heart surgery, like, they mask up. So they're like, oh, well, like, it don't work or whatever. And like, everyone hates Jared Polis, like, oh, he wants to just keep us in the mask. Like, and then they're like, oh, well, only the N95s work. But I think there's like that Facebook picture where it's like, kind of best way to describe it is, okay, so If if a guy, I don't know, I just really like this, so I want to share it. So it's like, all right, so if all right, if two people aren't wearing pants, okay, and then the first one pees, he gets pee on you. Okay. All right. So if you wear pants, but he doesn't and he pees, then he still gets pee on you. But if he's wearing pants and you're wearing pants and he pees, he just pees on himself, and that's like the mask and kind of analogy of it. So that's one form of protection, and it's like it's the best way to like protect yourself. But I think that now, like, I mean, people, it's frustrating. People are still flipping out over masks, but so, yeah, I think we kind of got off topic a little bit, but yeah, I mean, just how's being a mom during quarantine and COVID and all that?
Um, it's honestly kind of easy. Like we just stay home, we just hang out. Like
We're
never,
such homebodies now.
I never like to be home. I've just been so used to like always on the go and going here and going there and never being home. So now that I have to be home, it's a lot easier because I have someone like to hang out with and just play and she keeps me busy for
At the same
sure.
time, it's harder to leave the house
Yeah,
now.
yeah, it takes us forever to get out of the
I
house.
mean, we were late to this.
Yeah, I'm always late, and now I'm even
Now
later.
we're even way later.
So, it's great. It's definitely hard. Like there was times where I had to like back off seeing my parents, and but now I just take the extra precautions and I try to be as safe as I can, and um, just spend some time with my baby. And she loves her grandma and grandpa, so we go hang out with them. And um, yeah, we just now that it's gonna start getting nice, we'll take her to the park, and we took her yesterday and wiped down the
I
seats
know.
and
That's
stuff.
like a new normal, like wiping down
But I mean,
everything.
I was thinking about it, and I was like, why didn't you wipe down before? Like, there's homeless people and like people like that always touched it,
Yeah.
and I
And
guess you just never know where anybody's hands were, so I guess it's safer.
I know that's like crazy. Like, just think, like, we used to go into restaurants, open the door handle, not wash your hands, go sit down, eat chicken wings, and like sit here and like,
Well, just like kind of like a meme my sister-in-law said, and it's like I used to like put my hand in this bowl with the bowling ball and put my
yeah,
fingers in the holes and then go eat hot wings and french fries like
like
with that
nothing.
same hand and not even think about it.
Yeah, so I mean, it's definitely complete change of everything. I mean, life's never gonna be the same. Like, well, I would think everyone would be extra precautious. Maybe it's a good thing because, like you said, like, look, um, the flu, like cases are down, or you never hear of anyone getting the flu, and it's because people are being cautious, washing their hands, wearing a mask, and so I mean, there's maybe a little good. Maybe we'll be more safer and healthier.
Yeah, hopefully, and
Who knows?
we'll see.
Um, yeah. So let's see what else. Oh, so I mean, what do you think about this that I'm doing? I mean, how do you feel about this?
I mean, it's fine. It's whatever you want to do. Like, we'll support it. It's out of the out of the box for sure.
Yeah, I mean, it was definitely hard for me to put myself out there. I think, like I mentioned to you, like before, I was like, should I like should I bring this up? Like, should I tell people about that? And it was like super nerve wracking for me. And like, I know for you, like kind of bringing you on here, I kind of dragged you here, but I mean, it's out of the box. It's a little uncomfortable, and but enjoy it. And I've received a lot of good feedback from this. People reaching out and thanking me for putting myself out there and doing something positive. And I've had old coworkers text me and tell me they love it. And um, yeah, I mean it was nerve wracking for sure. It was like as soon as I dropped it, like I just kind of had to drop my phone and like walk away and like, oh shit, like now what? But yeah, I mean it's been going good so far, and I wanted you on here because I kind of wanted you to give the whole like nurse perspective of the pandemic and COVID and all that, and you think you're not that interesting, but I mean you covered a lot of good stuff, and you are. I mean you are interesting. You you are you've came a long way, and and you're a first generation Mexican American, so
Yeah.
yeah, and uh, so I mean that's good.
I would say we're doing pretty well.
Yeah. Um, yeah, 2020 was a rough year for us. I think not just with the pandemic, but I mean a lot has happened.
Yeah. I mean, only hoping it gets better from here on out.
Yeah, I mean we could only go up, right?
Yes.
Um, I think on top of that, I mean just kind of like everything that's happened with like the election. I mean that was intense. That was interesting for you and I both. I mean the I was like following it so close and like couldn't get sleep and was like tossing and turning, like constantly checking my phone and all that. And I think it was like, um, I mean, like being Mexican and having a Mexican family. Like, I mean, how what was? I mean, it was like a huge win for us because just kind of everything that happened, during his terms and all that, and like trying to deport everyone and throwing kids in cages and just all that negative things that came associated with it. I mean, how like as far as like being Mexican, like I mean, what was kind of like your outlook on it and like with your parents and stuff?
I think it was definitely hard. I mean, you have like my mom talking to her family in Mexico, and they're like, "Damn, like the shit sucks over there." Like, and that's coming from the other side. Like, you're just like, well, if they think it's shitty here, then like it is.
Yeah,
Like they're dealing with the cartels and like bad stuff over there, but um it like you just see like all these posts like where like people are just like if you're speaking Spanish like in the store and you like see like someone like basically like talking shit to you and like going back to like go back to Mexico like all this stuff like I would like go off on somebody if they did that to my mom. Like I
really.
would literally like I've never been in a fight, but I'll fight somebody like um because like one that's just like they're not doing anything to you. Like they're trying to just go grocery shopping and like people are just like so ugly. Like I think it just brought out like the ugliness. Like I think usually like sure like if you want to be Republican, then be Republican or you want to be Democrat, like that's fine. Like but this was beyond that. Like it
Yeah,
was
it's
more of
about being
like
a good person. Like,
yeah, and like I don't know. Then I seen people like post like, "Oh, would you have Biden watch your kid?" And I was like, "So you'd have Trump watch your kid? Like what? Like
yeah,
what? Why does it even like come to that?" Like I think people are just like uneducated. I think that a lot of people were getting their sources from Facebook and like they weren't actually like researching and they weren't just like looking beyond their but like their beliefs. Like it's just about what they want and that's it. Like
yeah. Like if he supported like one thing, like like the taxes, then we'll push everything else to the side. But he's about taxes, like you know what I mean. And it's like you're giving all that up, like for your one belief, just for like not being a good person. Like
yeah, like it's just it goes beyond that and it's like but right now like everybody's mixed with something. Like it's
yeah,
you're not just white and that's it. Like your family came from somewhere.
yeah. There's Irish and Italian, and there's probably some Native American in there, and
Yeah,
like there's
like
so much mix. And I mean your parents did it the legal way. I mean they did everything the right way.
yeah, I
Like
mean they came the right way and so it's possible, but like I also know like people who didn't like still don't have papers like and they're not bad people. Like it
no,
doesn't that
and
doesn't make them a bad person and especially if they came as a kid like they they had no choice. Like, were their parents supposed to just like come over here and then be like, okay, well, you stay over there, I'll be back?
yeah, like
Like
come when
they
you're ready, or you're like
and like people don't realize like you know more people than you think you do that are in the situation, and like if you're thinking so ugly about just the general, like putting that stigma on the general population, like, well, did you think about your friend that you went to school with? that is Mexican and
Yeah.
like their family is dealing with something, without being legal. And like, you're sharing all this ugly stuff and like you're talking like you're being racist basically.
Yeah.
But like you went to the same school that I did.
Yeah.
Or you grew up in the same
Are
neighborhood
you
that
you've
I
been
did.
around the same people that we've been on? Because I mean, both of our, I mean, all of our schools, I mean, we're primarily like just Mexican,
Hispanic,
yeah,
yeah.
Hispanic, and all of my friends, I mean, are Mexican, and but like, yeah, like I mean, I don't know. Like I said, the biggest thing with how what I've found out this day and age is like people are ignorant and they're selfish. I mean, they've always been, but like people are more prone to show it, and I think that's because of who's their leader and kind of pushes them to be like, you know what, I don't have to keep this in the dark no more, and it's not taboo no more, and I'm gonna express how I feel, but I mean it's like super selfish, and I know like with the election, like I mean I was stressed out, like I mean this is the first election, and I mean I've always, I don't know why, I've always been like so interested in elections, and I remember like Bush running and Al Gore, and I like remember watching those on TV and like just being so into them. But like all the times that like Bush won, I was just like, like life goes on. Like it was like your sports team didn't win. The Broncos didn't win the Super Bowl. Like yeah, it hurts, whatever. But life goes on. And I think like the biggest was like with Obama, and I think that was just huge because I mean he was the first black president, and that was like so exciting just to finally have that like change of just every president before him that were white, and now we finally get like a black president. And I think when Trump ran in like 2016, that kind of like changed everything, and like I think we were watching it and like he won and we're like damn, that sucks, like I think that's more of like your team not winning the Super Bowl and like the Patriots winning, and you're kind of like like damn. But like this one, like I was just so involved and just like so drawn to it, and to me it was like it was like it was huge, like.
Well, I think people were actually like scared for their lives.
And
Like,
I was like we were like I think my whole perspective kind of changed on things like having a child. It's kind of like I mean I was worried for her, like I didn't want her to like grow up in this type of world, and like everything that's going on like now with like them storming the Capitol, and like a little bit of it's still like kind of going on, but I mean like can you imagine like if he had 4 more years, like what would happen? And I felt so close to it because um like I said, like her parents are Mexican, her mom's Mexican, and like a lot of my close friends were Mexican, and I mean I'm sure I have like some type of Mexican in me, and but like I like to think of myself, just loving the culture and everything that comes with it. I mean, like those, I classify those as my people. And, but yeah, I mean, just like I was scared for her, and I didn't want her to be in this world like this. And I mean, I even mentioned to you, like let's move countries, like what I mean. Like I was like really trying to figure out how to like. I knew we couldn't go to Mexico just because of everything that's going on down there, but like I that was my mindset where I was like I don't want her to grow up in this.
yeah, it's scary. And now I think with Kamala Harris as like vice president, like
And that's so
it
huge.
opens the door for just like women.
Yeah, and I'm
like,
like,
our daughter has the chance to be president if she wants.
yeah, and it's possible, and I think that's a lot of good that's came out of it. All right. Well, yeah, I want to thank you for doing this, even though you didn't want to. I don't know. How do you feel? How do you feel it went?
I think it went okay. It's nerve wracking. Like I felt like I was in an interview, and I mean, I think you do get a little bit more comfortable like after you start talking.
Once it starts rolling, yeah.
Um, but I think it definitely wasn't in my comfort zone.
I'm glad I could pull you out of that a little bit. And I no, I just wanted you to be my first guest, and it was harder. I think I thought it would be more comfortable, like just like me and you talking. Just because I mean, we're partners obviously, and we talk every day. But it was kind of hard to like ask you stuff that I already knew about. And so, but no, it's a learning experience, and I thank you for coming on and sharing what you felt comfortable sharing. Um, I'll have you on again someday. I know I will for sure.
Well, thank you for having me.
Yeah. So yeah. Thank you everyone for listening. Yeah. Continue to support. Continue to share. I really appreciate it. My numbers aren't crazy as far as like followers and likes and things like that, but that was the ultimate goal, was to get the people around me to support and kind of spiral out from there. And I think I succeeded at that. Everyone that that's been supporting their friends, I'm getting some new followers and some new likes and things like that. So yeah, keep supporting. My ultimate goal is to at least release one episode a week. Um, it's gonna be hard, but I'm definitely gonna try to do everything I can to do that. I've reached out to a lot of people that I'm looking to have on here, and we're gonna start planning stuff. We're in the studio now. We didn't get to do video, but I think on my next one, we're definitely gonna have some video. Like I said, I want to be able to see us engage, and I just think it's a little bit more personal, especially when some guests are going to be bringing in things that they're trying to promote and that. Yeah, so thank you for tuning in. This is the Good Convo, Good People podcast with me, your host, Jordan DeLeon. Thank you, Natalie, for being on here.
Thank you for having me.